Hello, my name is Dr. Olivia Moses, and welcome to Wellness Live, brought to you by Loma Linda University's Living Whole Wellness Program. We are so excited to have you today, and please tell your friends all about our Wellness Live session this evening about diabetes. And we are going to have this particular session archived for you on our website. So if you would like to share that with your friends and family, please feel free to do so. I'm very excited to have a wonderful colleague with me today. Her name is Dr. Debbie Clausen. She is the manager of Loma Linda University's Medical Center's Diabetes Treatment Center. She's been with us for 14 years, and she's been working in the area of diabetes for 19 years. So she is a great person to talk to you today about demystifying diabetes. So without further ado, I give you Dr. Debbie Clausen.
Good evening. Thank you for joining us this evening. And I'm very delighted to be talking with you about diabetes and to demystify it. There seems to be a lot of misunderstandings about diabetes, and I hope you will learn some of the principles tonight. So the objectives for tonight are to tell you what diabetes and prediabetes are. What does glucose and insulin play? How does that interact with diabetes? What are risk factors that we may have for diabetes? How is it screened and diagnosed? What's the treatment for diabetes? And the behavior changes. We have some very alarming statistics for diabetes. On the left side, the vertical picture is telling us that 1 in 3 U.S. adults is at high risk for developing diabetes. We've never had that much risk for diabetes before. Moving to the right in the big yellow box, there are currently, or as of 2012, 30 million people in the United States who have diabetes. Then another 79 million who have prediabetes. Just on a note, when I started working with diabetes 19 years ago, there were 16 million known people with diabetes. So we've nearly doubled that. You may have heard a lot of predictions about diabetes, that there is a coming epidemic, and I believe that we have arrived there. I see that in the statistics and in the number of people who are coming for treatment. This is an interesting slide that's also alerts us to the seriousness of obesity and diabetes. On the top row tells us about obesity and how that has increased in our country since 1994. The darker the states, the number of people with obesity is increased. Over here on the far right, the darkest orange represents at least 26% of those states have diabetes. The lower part is diabetes, so what's the percentage of the country that has diabetes in these years, going back to 1994 and up to 2010. And I'd like to bring you attention to this little state here called Mississippi. In the year 2000, it had the highest rate of diabetes in the United States. Then were added a few more states close to it in the year 2010. What are some of the risk factors for diabetes? Being 45 years old or older, being overweight. If we exercise less than 3 times a week, that puts us at greater risk for diabetes. Do we have an immediate family member that has diabetes? This would include a mother, father, or a sibling, or a child. Then there are some racial ethnicities that have higher rates of diabetes than others. High blood pressure is also a precursor to diabetes. So the more of these risks that you have or you answer yes to, you have a greater risk for developing diabetes. Some of these you can do something about, but you can't do anything about your ethnicity or your family history or your age. So what is diabetes? It's a disease that the body cannot produce insulin, or the insulin that it produces is not used properly to convert sugar or glucose into the energy that we need. Some of the common symptoms, burning, tingling feet, and I might add, these are some of the symptoms of the complications with diabetes. An unusual hunger that you can't seem to satisfy, and you have this voracious appetite. Blurry vision is another one. When your blood sugars are high, your eyeball actually changes shape and causes the blurry vision. Fatigue that is unusual. You can't seem to sleep enough, and you may feel not just tiredness or fatigue, but something isn't quite right. Weight gain or loss, either could happen. And thirst, you may have heard of this one. So in type 2 diabetes, these symptoms may be very subtle, maybe not noticeable. They're easily ignored because they're not strong or they're not really showing themselves. They can be attributed to other things, and they can go on for years and years without someone seeing their doctor or even being curious about what's going on. So what happens with diabetes? Well, the body cells cannot use insulin properly. That means that your body is resisting the insulin. Insulin is a hormone that helps to move sugar from the blood vessels, our circulatory system, into the body cells. Something else that happens is the pancreas cannot make enough insulin, or it cannot make insulin at all. So without insulin, glucose stays in our bloodstream, becomes high, and at that point our cells, every body cell, is starving for sugar or energy. That person will then feel a lot of hunger, a lot of fatigue, because the food that they eat is not being changed into energy. Let's talk about the types of diabetes. Type 2 is the most common type, and if we would put all types of diabetes in one group, 90% of them would have type 2 diabetes. It's associated with heredity or family history, obesity, and a sedentary lifestyle. Type 1 diabetes is not as common. About 10% of all of those with diabetes have type 1, and it can occur at any age, but usually under the age of 50. And we know it's a serious disease, but why is it so serious? Well, it's a leading cause of new blindness, kidney failure, amputations not caused by an accident. It's a major cause of heart attacks, strokes, and poor circulation. And diabetes has moved down from the 7th leading cause of death in the US to the 6th. So now we're going to go into what glucose and insulin are. As soon as we start eating, our blood sugar or blood glucose starts to raise and go up. That signals the body to secrete insulin, and the work of insulin is again to move the glucose into body cells. And the glucose that you don't need for that is stored for later use in the liver, in the muscle, and in some fat cells. So that between meals, when you're not eating, you have some glucose that you will need if you take a hike, ride a bike, or do some extensive housework, or you're extending a lot of energy for something. Insulin, we've all heard the word, but what is it really? Well, it's a hormone, like the thyroid hormone, and it's made in the pancreas that sits right behind and under our stomach. So the pancreas will make some insulin. It's secreted as we start to eat a meal. And then again, the insulin helps move glucose into your body cells. Between meals and when fasting or during the night when you're not eating, you still need some energy just for the work of breathing, for your heart to keep beating. And there's slow bits of glucose and insulin that are secreted through the night. We are approaching the 100th year of when insulin was discovered. So in December of 1922, there were two scientists who developed insulin, and this little guy here was the first person to receive insulin. This happened in Toronto, Canada, and you can tell just by looking at him how ill, critically ill he is. He's lost a tremendous amount of weight. He has no energy. He's just barely alive. Here's the same child 3 months later, February 15. So this is what insulin does for us. It helps to store fat. It helps to store energy in our body cells. You may have wondered, what do people see, or how much can they see if they have some damage to their eyes? So this is what a person with partial vision might see. And the disease associated with this is diabetic retinopathy. That occurs after several years of poorly controlled blood sugars. These dark spots here are areas on the back of the eye where there's been a hemorrhage or a bleed, and so vision is gone in that area and cannot return. Now let's talk about prediabetes. Some of you may know this term by borderline diabetes, but that's been gone for about 10 to 15 years, and now it's known as prediabetes. So what is it? It's higher glucose levels, but not quite high enough to be type 2 diabetes. Used to, when a patient would learn that they had borderline diabetes from their doctor, they would say, you know, don't worry about it. Go home, you're fine. But then that person would be back in 5 to 10 years and have diabetes. We can do something about prediabetes to prevent the diabetes onset. There's just 2 steps. The first one is to make small reduction in our body weight. 5% of a 200-pound person would be only 10 pounds. And that is a doable goal, something that you just are not overwhelmed with. And then making modest increases in exercise 5 times a week. These two steps will greatly decrease your chance for diabetes. Who should be tested? This has to do with the screening methods. All individuals over 45 years old. The body mass index should be screened. But then younger people need to be screened if they have a high BMI, which would be over 25, or if they have other risk factors. The testing methods would be a fasting blood sugar level at the lab or a glucose tolerance test, and we'll talk about that in just a minute. The treatment for diabetes, number one, is to get diagnosed. If you suspect that you have diabetes, don't just wait around till you get very, very sick with it. And then once you're diagnosed, treat it aggressively. You want to keep your blood sugars as close to normal as possible to avoid the risk and complications with diabetes. And I might add that diabetes education is considered treatment. For both type 1 and type 2, we encourage people to modify their lifestyle, lose weight if needed, take their medications if needed, and again, get some diabetes education. Self-monitoring the blood sugar at home so that you know what changes you need to make, and get your blood test for the hemoglobin A1C done every 3 months to give you a big picture view of how your diabetes is really doing. We need to make an appointment with our doctor every 3 months just for a diabetes visit. Nothing else should come up in the visit. And the things listed here are all the things that should be done just during a diabetes visit. Now, we use the plate method for teaching people about what to eat. So these are the various food groups. We have vegetables here, over half of the plate. Starches and carbohydrates over 1/4 of the plate, and then the proteins over another 1/4. Fruits and milk also are considered carbohydrates, but those need to be included. So we've got the groups here, but what would a plate look like if you have the combinations of food and the amounts? So again, we've got half of the plate of vegetables, our carbohydrate in the tortilla and protein in the egg, and similar foods on the left side. Benefits of exercise. Well, this is a long list. It's not new to us, but is it worth it to exercise and to get our energy up also with exercise? We can determine that by how we feel. It improves our heart health. It improves our stress management. We have more energy. We sleep better. And our cholesterol and blood pressure improves. If you start a physical activity, you want to start slow, not with a bang that is going to immediately tire you out, but start slow and gradually increase it. Wear good fitting shoes and be safe. Carry a cell phone. Be sure to let your doctor know. He may want to caution you. And do something that you enjoy. Try different things and find something that you like and you know you will do. Changing behavior is probably one of the hardest and most challenging parts of diabetes management. One of the first steps is just to be aware that a change is needed. Then to commit to that change. Set a realistic goal. How important is it to you to improve your weight and your blood sugar? Is your goal achievable? Can you really make it happen? And then we want to focus on behaviors. We could say, I will lose 5 pounds in the next week. That doesn't say what you're going to do to improve your weight and your blood sugars. Basically, you want to get specific about what you're going to do, such as I will change from whole milk to skim milk. Then you want to evaluate your progress. Did you make the changes? Can you see that a change happened? And what helped you to make the change and what got in the way? We need to really celebrate our success. That might not be with food, but something that's not related to food. If we have failed, that day will end and we have another day to start and keep moving forward. So the keys to success are to educate yourself, take responsibility for what you need to do, talk with your doctor, and practice good self-management every day. And I think there may be some questions from the audience.
Well, thank you, Dr. Clausen. And yes, we do have some questions from the audience. The first one from one of our viewers is probably one that you get quite a bit. And it's actually a fairly interesting question. Is it true that diabetes is caused by eating too much?
That is a myth about diabetes. What causes diabetes is having extra fat cells, especially around the middle. And it is true that if you eat too much, that will happen. It's not eating sugar. Sugar does not cause diabetes. It's extra fat cells or extra weight requires more insulin, and it requires that your body work harder to make enough insulin, and after a while your pancreas cannot keep up with the amount of insulin needed.
Okay, great. Another question we have from our audience is, do physicians check for diabetes during your regular annual physical?
That's a very good question. And I'm happy to say that yes, they do. A lot of our patients come to our clinic and say, I had no idea that I had diabetes. I just went in for a routine checkup and my doctor called me and said, you know, your blood sugar is high. We need to get this taken care of, have you go to some diabetes education classes, so we can help you prevent complications.
So our next question actually goes along with the one that you just answered. So if my physician checks for diabetes, so I get my glucose tested, what should my glucose level be?
That's another very good question. So a normal fasting blood sugar is less than 100. The pre-diabetes area for fasting glucose is just a narrow band of 100 to 125. Then a fasting blood glucose of 126 or higher is diagnostic for diabetes.
Okay, great. Another question that you probably get a lot is, what if my grandparents have diabetes? What if my parents have diabetes? Does that mean I'm going to get diabetes?
Not necessarily, but it is one of the risk factors for diabetes. So you would want to make a list of what risk factors you have. Do you have most of them, such as being overweight, being inactive? And we went over those toward the beginning of the presentation. So if you have some of those risk factors, you would definitely want to be screened or have your blood glucose lab test done about annually or more often.
Okay, great. Now, you know, speaking of will I get it, and I know you talked about certain things that are changeable and not changeable in your life that could potentially prevent you from diabetes. What can we do right now to potentially prevent us from getting diabetes in the future?
I'm glad someone asked that. We have two very successful and promising steps we can do. One is just to reduce our weight by 5 to 7%. So someone that weighs 200 pounds, 5% weight loss of 200 is only 10 pounds. That's not too overwhelming. And then to help you succeed is to do 5 days of exercise or 30 minutes for 5 days a week of moderate exercise. That would not be slow walking or it wouldn't be running, something halfway in the middle there. And that has been shown through research to decrease diabetes by more than 53% in a group population.
Okay. Now, in your presentation, you talked a little bit about the diet. Now, one of our viewers asked, is there a diet protocol specific for individuals with diabetes?
Yes, there is. The American Diabetes Association gives us some guidelines for developing diets or meal plans for people with diabetes. The main principle is to have a balanced diet. Now, we all know that, but in diabetes, what does that mean? It means we need to have a protein food, carbohydrate food, vegetables, milk, and a little fruit every day. And you'd want to have the protein, the vegetables, and the carbohydrate at the same meal. If we eat a meal just of carbohydrates, our blood sugar will rise rapidly and steeply. If we combine that with a protein, we don't have such a dangerous rise in our blood sugar.
Okay. Another question that we have from one of our viewers is, are individuals with diabetes at higher risk for gum disease?
Yes, we see quite a bit of that, and it is recommended for people with diabetes to see their dentist twice a year, to brush their teeth twice a day, and to floss once a day. When you think about high blood sugar and our circulatory system, we have blood vessels carrying blood everywhere to our body. And all of that blood is saturated with sugar, so infections can occur anywhere in our body. But one of the common areas is around our teeth and the gums. So keeping them clean, seeing our dentist are good ways to prevent those.
Follow-up question to that is, we hear a lot about the feet too. Can you speak a little bit to that?
Certainly. Our toes and our feet are the furthest part of our body away from our torso. And when we start having numbness or discoloration in our toes, then we know that there is a circulatory problem and possibly a nerve damage problem. So some people lose the feeling in their feet. The high blood sugars actually create a coating over the nerve endings so that we don't feel what we're walking on or where our feet are. So we need to be looking at our feet, not just the top of them, but the bottom of our feet as well every day, looking for red spots, new open areas, blisters. This will go a long ways to prevent a foot sore that may take months or even a year to heal.
Thank you so much, Dr. Clausen, for joining us for this discussion on diabetes, and it has been extremely informative. If you are an employee here at Loma Linda University Health covered under one of our health plans, we have a wonderful type 2 diabetes program for you called the BUILD program, and would love to tell you more about it. So if you are interested in the BUILD program, please email us at livingwhole@llu.edu. My name is Dr. Olivia Moses, and again, thank you for joining me for another session of Wellness Live.